Thank you, Ms. Welch.
you.
Good morning, sir. Would you introduce yourself, please, for the record?
Mr. Chairman, Rob Hernandez, a pleasure to be here. And actually three things, and I'll be really brief and follow up. What I want to do is follow up on the draft that I submitted last time, because I think in the February meeting, Desta, you asked, well, what are some solutions? Well, there's a whole series of solutions, but there's no one major solution to a number of these problems. But last month, I'd submitted a document that it was actually a midterm research paper from healthcare leadership at the University of Denver that pretty much noted the research that individuals that have intellectual developmental disabilities, 40% of them have chronic conditions. And so most of that care, they can't wait for a primary care physician, because the wait times for primary care physicians in this country is anywhere from 3 weeks to 4 weeks. They can't wait. So a number of times the standing orders are, let them be treated in the emergency room because they need care now. So that was the draft that I had passed, and but what I want to do is follow up with another article. This is from the Disability and Health Journal. I'd like to submit this for the minutes. Sorry I didn't have time to whip out another paper, but at least I think if you take time to read this document, what that says is that in order to reduce emergency room and hospital utilizations in persons with multiple chronic conditions, there's what's known as receiving home-based primary care. Think doctor visits, think doctor house calls for this population. So you've got Susie, who has numerous chronic conditions. It's 10 below out. Why are we going to take her out in the freezing cold to an emergency room when we can have a list of physicians that will come to the house and assess her to determine, does she really need to go to the hospital? Does she just have a cold or a cough? Or because what they can do is that they can assess all those primary conditions to determine if actually she needs an emergency room visit. That's one solution. It doesn't work for all of them, but let's say one that's probably even better is one that's more consistent, is what's called primary care medical homes. And don't think of an institution, think of it as a whole process, a whole support system, where you have a primary care, a physician, and you have a nurse, and you have access, and you have a whole team of people that are actually looking after these individuals that have the chronic conditions, whether they are someone with an intellectual developmental disability, or whether it's someone that is a senior, anybody that is at risk. And that's the thrust of this particular this article. So I think if you take time to read it, but what they conclude is, after doing all the thorough research, and what does the credible data say? They say the provision of home-based primary care for persons with multiple chronic conditions and disability is associated with a persistent reduction in emergency room visits and hospital use. And in addition to that, CMS, Center for Medicare and Medicaid Services, has a program basically that's something similar. It's called the Independence at Home Project, and right now it's wrapping it up. And what they've shown in a control group of individuals that had primary-based home health care from physicians, and the control group that did not, is that the reduction in emergency room visits and hospital visits or readmissions was dramatic. And in addition to that, what kind of money did it save? So it had quality healthcare outcomes with these quality measures, but it saved close to $8,000 to $10,000 per individual. So that is something that I would like to recommend that leadership at Human Services does, and certainly Healthcare Policy and Finance, because these are accessible programs that they should be utilizing. So those are a couple of solutions. So I wanted to present those to you, but I didn't want to just whip them off the top of my head without any data, methodology, or somebody that had done some surveys, something that was credible that actually has worked. So that's one. There's a couple of solutions for the at-risk population, which is a lot of the rules that you do. So it's something to consider down the road. So I certainly hope that that leadership in both departments, Human Services and Healthcare Policy and Finance, would consider implementing something like this in Colorado. And the reason I bring that up is because so that Adult Protective Services will know that just because an individual went to emergency room multiple times for their chronic conditions is not an indicator of neglect or a reason for substantiation. That's the point I wanted to make. And I would also like, that perhaps maybe when they pause, or when they get to the academy and they're talking about emergency room visits, that they have experts come in and say, let us educate you on what this population is, and they have chronic conditions, and why you're going to see numerous emergency room visits, and don't just jump to, well, there was 4 emergency room visits because she has chronic bronchitis, or she has whatever the chronic condition is, and that's the reason they went. Just don't jump to the conclusion that there's substantiation for neglect. That, I think, is a good education piece. that probably should be utilized, and so I would recommend that as well. And the other thing that I want to touch on real quickly is the adults, the ADA and civil rights, is that the perception is some of the rules that are passed do violate their civil rights and the ADA. So you might want to consider weighing those when you're looking at these rules or question that. I do know that the Civil Rights Commission is taking a close look at all of these rules as they move through the process. So I just want to point that out. So thank you for your time. It's great to be here, and do you have any questions?
Thank you, Mr. Hernandez. Questions for Mr. Hernandez? I guess it would be Senator Hernandez, wouldn't it?
Yeah, and Senator Johnson.
My apologies.
I get that all the time.
Questions for Senator Hernandez? Excellent. Thank you. Appreciate the follow-up. Thank you both for being here this
Thank you.
morning.
Thank you.